In a remote forest, a veterinary team unloads heavy medical kits. Their mission: save a wild elephant that hasn't eaten in days. The team organizes syringes and antiseptic solutions with practiced urgency. Local villagers watch anxiously, knowing the elephant's suffering has been unbearable. A veterinarian carefully measures the sedation dosage. One mistake could be fatal for an elephant already weakened by starvation and infection. Final equipment checks complete, the team prepares to venture into the brush. Somewhere in those trees, a magnificent creature fights for survival. The rescue team treks across a scorched field, yellow and black toolboxes in hand. Each step brings them closer to their patient. Walking single file, they enter dense woods. Silence is crucial. They can't risk startling an injured elephant in this vulnerable state. The team slows their pace, scanning the foliage carefully. Then, through the trees, they spot the massive gray form standing motionless. The sedation dart flies true, delivering its precious cargo. Now begins the delicate wait as the medication takes effect throughout the elephant's body. A team member moves closer to assess the elephant's condition. What they discover next will reveal the true horror of this animal's ordeal. Severe damage mars the elephant's mouth, likely caused by a hakka's explosive trap. The cruel device has left devastating injuries that prevent eating. Gloves snap into place as professionals prepare to treat the open infections. This elephant's body tells a story of human cruelty and survival. The team carefully probes the elephant's mouth, revealing extensive damage. For days, this magnificent animal has been unable to feed itself properly. Two team members consult medical charts, cross-referencing protocols. An elephant in such fragile condition requires precise, coordinated treatment to survive this. A veterinarian prepares a large syringe of potent antibiotics. The systemic infection has caused severe swelling that threatens the elephant's life. The first injection pierces the elephant's thick hide. Pain relief and infection-fighting medication begin flowing through the weakened giant's bloodstream immediately. Multiple syringes deliver a cocktail of vitamins and medications into the elephant's rump. Its failing immune system desperately needs this boost to fight. The veterinary crew works in perfect harmony, their movements practiced and efficient. Years of dedication to wildlife protection show in every careful action. The horrific extent of Hakka damage becomes visible once more. Careful irrigation and antibiotic application are vital for any chance of recovery. This is the moment that defines everything. Working together, they flush the mouth wounds, painful but absolutely necessary for the elephant's survival ahead. Despite obvious discomfort, the elephant allows the team to continue their work. This trust between species in such circumstances is truly extraordinary. The team carefully monitors the elephant's breathing throughout the oral procedure. Keeping the airway clear is critical during this invasive treatment phase. They finish the oral irrigation and prepare a final round of injections. Every medication delivered maximizes this elephant's chances of beating the infection. They load medicine into a syringe for easy application inside the mouth. Topical antibiotics will provide additional protection against the spreading infection. After completing the intensive treatment protocol, the reversal dose is carefully prepared. Soon, the elephant will wake from its medically induced sleep. Team members follow at a respectful distance as the elephant begins moving. They must ensure no further threats confront this recovering animal now. The elephant pauses to rest, trunk touching ground briefly. It's gathering energy, preparing to continue its journey back into the forest's embrace. The team expresses cautious optimism about the elephant's chances. If the antibiotics overcome the massive infection, it should be feeding again soon. A wide shot captures the peaceful forest where the treated elephant now rests. Against all odds, hope has returned to this remote corner of wilderness.